How is scoliosis named? Scolios is an ancient Greek word for bent or crooked, and scoliosis has been around since ancient times. The condition was first described by Hippocrates and by Galen. Scoliosis is the development of an unnatural sideways curvature that also twists or rotates into the concavity. Normally, scoliosis is diagnosed by a combination of a physical exam and an x-ray, and normally the combination of these two tests normally results in a diagnosis of scoliosis. A scoliotic curve has to bend unnaturally to the side and rotate and must have a minimum Cobb Angle measurement of 10 degrees or greater to be considered scoliosis. Part of diagnosing scoliosis involves a comprehensive assessment to either further classify the condition based upon individual variables, and how these individual conditions are actually named can influence how you actually classify the scoliosis. So what are the variables that are involved in naming and classifying a scoliosis? The first thing is something that we consider as patient's age. It's the first thing we look at. So whether the patient is an infant, a juvenile, adolescent, adult, late stage adult, patient's age. So we call it either infantile scoliosis, adolescent scoliosis, adult scoliosis. The second part in the name is going to be the type of scoliosis that is, meaning what we think it's being caused by. So we either have, most of the time we have like 2 or 3 things to consider. If it's an adult, we can consider 4. So it's going to be either idiopathic scoliosis, which we say we don't know what's causing it. We can say it's neuromuscular scoliosis, that we believe it's a result of a neuromuscular condition. We can say it's congenital scoliosis, that we believe is a result of a hemivertebra in the spine that actually happened in utero that was there at birth. Or we can say it's degenerative scoliosis that occurs in the adult stage life. So it would be something like adolescent idiopathic scoliosis. The third classification is curve location, and that's going to be determined by where in the curve is actually occurring. Is it occurring in the neck? It would be called a cervical scoliosis. If it's happening in the mid-back, it would be called a thoracic scoliosis. If it's happening in the lumbar spine, it will be called a lumbar scoliosis. So it will be something like adolescent idiopathic thoracic scoliosis. And then the last conditioning variable is severity, determined by how large the scoliosis is, whether it's mild, moderate, or severe. So the final diagnosis could be something like adolescent idiopathic severe thoracic scoliosis, and therefore you have your entire classification system there. Now, the severity is based upon the Cobb Angle, and we know the Cobb Angle is the gold assessment in diagnosing a scoliosis. And this measurement is typically attained during an x-ray by drawing lines from the most tilted vertebra on the top to the most tilted vertebra on the bottom, and looking how these 2 lines intersect. And this intersection is expressed in an angle in degrees, and the higher the Cobb Angle, the more severe the scoliosis is. Mild scoliosis cases are typically less than 25 degrees. Between 25 and 40 is considered moderate. 40 or greater is considered severe. And very severe is something that we call 80 degrees. So just to review, you understand a diagnosis of a moderate adolescent idiopathic thoracolumbar scoliosis means that the curve is between 25 and 40 degrees. That's what moderate means. Adolescent means that it's between 10 and 18 years of age. Idiopathic means we don't know exactly what triggered the condition. And thoracolumbar means that the apex of the curve, or the curve, is located in between the thoracic and the lumbar spine. And this is how you classify a scoliosis based upon those types of names. So you can see here any variation of age, cause type, location, and severity are the 4 main things that we use to classify or name scoliosis. Now, based upon the classification, we determine the best treatment option. Now, we know scoliosis is not curable, but we know scoliosis is highly treatable. And the sooner you treat a scoliosis, the more likely you are to lead to a non-surgical outcome. We know scoliosis can be treated surgically or non-surgically, but because of the invasiveness of surgery and the risk associated with it, surgery is normally left to curves that become severe in nature, greater than 40 degrees in adolescents. And in adult cases, surgery may not be even considered in severe cases because the negative effects that scoliosis surgery could have on adults. So many times they have to wait for the scoliosis to become severe and for there to be complicating factors associated with the patient, meaning they already have severe pain or severe malfunction because of the risk of scoliosis surgery. If scoliosis surgery didn't have any potential risk, didn't have any negative effects, they would do scoliosis surgery in much smaller curves curves, but because they know about the limitations and the risk associated with it, they have to wait for the curve to progress before they can perform this type of surgery. Now, the good news with non-surgical approaches using things like therapy, rehabilitation, corrective bracing, condition-specific chiropractic care, we know that these treatments are very safe in nature, meaning the risks are very, very, very low. So therefore, we can treat curves at much smaller sizes, and we can treat them through their adult life as well, trying to manage and reduce scoliosis without having the risk of very negative effect as a result of the treatment itself. So as a result of this, we can treat curves at a much smaller stage. So as opposed to waiting until curves become 40 degrees in the adolescent to where you can start to treat it, we treat curves as small as 15 degrees, trying to reduce and manage the scoliosis, because we know every severe curve was once small, so treating a small curve will produce a much likely chance you're going to ever have a severe curve. So the way scoliosis is named is based upon many different those 4 classifications, and this helps streamline our treatment process and informs us specifically what type of customized plan the person will need. Now, when you diagnose a scoliosis, we know it's progressive. So where it's diagnosed at any given time in terms of severity doesn't necessarily mean it's going to be that way for the entire life. And the way that things are designed by severity, it's almost misleading, because when they call a curve mild, what they're saying, it's mild relative to surgical intervention. But patients with mild scoliosis could have pain and dysfunction and severe effects. Patients with severe scoliosis may have no pain or dysfunction. So when they look at mild, moderate, severe, it's relative to the Cobb angle itself only, and it's only relative to treating the curve surgically. So most patients think, I have a mild curve. It may not be causing my problems, and they may have pain or symptoms or have some problems as a result of their scoliosis, but they're pushing it off because they don't think, because of the name saying mild, they don't think it's really causing anything. Remember, the size of curve or the classification is not related to what kind of dysfunction or pain it's causing. But we do know as curves get bigger, they're more likely to cause problems. So therefore, we recommend treat curves as soon as possible while they're in their smallest size to provide the best possible outcome. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.